Aloha, and welcome back to the Kupuna Connections television series. I'm Cullen Hayashida with KCC Kupuna Education Center, and we are providing this program to you to cover all sorts of topics with regards to seniors, for family caregivers, and those in need of elder care services. Today we have a fortune to talk about injury prevention for seniors. And first of all, before we get started, of course, let me have everybody introduce themselves. Tony?
I'm Tony Hathaway, and I'm a social worker, and I'm the education coordinator for the Kupuna Education Center at Kapi'olani Community College.
I'm Kevin Lockett. I'm a physical therapist with 21 years experience, and recently just written a book on caregivers, to help out caregivers.
Yes, Kevin is probably one of the most accomplished, I'd say, physical therapists in Hawaii, both in terms of his writings and his work in terms of serving the community. So thank you for joining us today, Kevin.
Thank you, my pleasure.
Yes. We wanted to, of course, talk about this whole issue with regards to injury prevention for caregivers. Of course, we've got many older adults growing in our community, and we've got caregivers, family members that are also older adults as well. And of course, if something happens to them, of course, then things fall apart. And of course, caregiving oftentimes is not an innate skill. We can make mistakes, and we can do it badly, or we can hurt ourselves. So question about of course, injury prevention is very important. But first of all, let me ask you about back injuries for caregivers. Is this a common problem?
It's a common problem. If you look at statistically, they statistically they show that the 6 of the top 10 professions are healthcare providers that are the greatest risk for back injuries. And when you look at those professions, they're usually the people that are in direct patient care, so your nurses' aides, your nurses, your physical therapists. So caregiving was quite stressful on the body and quite physical. Yeah.
Okay, and do you have any statistics with regards to what kind of numbers are we talking about in terms of people getting hurt?
Well, when they looked at actually industries, healthcare industry was number one. You would think construction and industries like that would have more back injuries, but healthcare injuries, it's very prevalent. Very prevalent.
Is that right?
And there's a lot of factors in regards to environment and things that could put caregiver at risk. And lack of education as well.
So what can caregivers do to prevent injuries?
Well, we spend a lot of time as a physical therapist, do a lot of teaching and training to educate caregivers to take care of themselves. As you alluded to, if the caregiver gets injured, then everybody's in trouble. And there's always so much focus on the care receiver and not so much focus on the caregiver. So we spend a lot of time of teaching caregivers the principles of good body mechanics. And if they can practice those principles, a lot of times we can keep them out of trouble and keep them healthy. Yeah.
Okay, we have some slides that you shared with us, and perhaps we can see some of them right now, that you brought along.
Yeah, so the first principle of good body mechanics is you want to have a good wide base of support. So when you're helping somebody or lifting, that you can be sturdy. And so a shoulder width of support is a good base of support, as the slide illustrates. But sometimes when you're caregiving, a lot of times you can't control the space that you have, whether you're trying to help somebody in and out of a car, you're trying to manage a wheelchair and the person, and the space is really tight, or space where there's not much space for a wheelchair in the bed. Then another wide base of support is kind of a scissor position where one leg's in front, one leg's behind, and it gives you stability in that direction too, so you can be safe to manage the person.
Okay.
A second principle that we teach, and this is a principle to keep you healthy regardless of what you're doing, but we're going to talk about applying it to helping a care receiver, is keeping the load close to you. So if you're lifting something and it's far away, as the slide illustrates, there's a really long lever arm and there's a lot of stress in your back. So if you try this at home, if you pick up a chair and take a step and try to lift it up with your arms extended, you'll feel a strain go right to your low back. So if you keep the load close to you, as the next slide will show, is the chair will weigh a lot less because you have a decreased lever arm and you won't have that stress in your back. So if you can imagine, helping somebody out of bed, lifting, and if you keep it that far, that's a lot of stress that kind of accumulates throughout the day and could lead to a back injury. Yeah. The next principle is to lift with your legs and not your back. And so this slide illustrates the wrong way to do it. And so again, this will apply if you're lifting anything at home, but definitely if you're helping a care receiver, is that you don't want to use your back because again, all the stress goes on your back. The next slide illustrates the way you should do it is using your legs. So your legs are strong, and then you basically hold your stomach tight to keep your back straight, and you can have a lot more force without stress.
And I notice you have that nice wide stance that you're using as you bend down to.
Right. So you want to make sure they're secure. Yeah. And the next principle is you want it's easier to push than it is to pull. So anytime that you're pulling, there's a stress can go to your low back. So if you're pulling, the stress goes here. So if you're pushing, you can keep a nice neutral spine and keep your back in a good position, and the load's a lot closer. The next slide illustrates. So this is a slide of trying to help somebody get up into standing, and so the second slide that you're looking at right now shows you're pushing, and so you can use your legs, and again, there's not stress on your back. So
Now, is there any danger with the person falling down, though?
no, we'll talk a little bit later about a different mobility going sitting to standing, but a lot of times the caregivers actually will just instinctively position themselves in front of the care receiver and end up doing more work and stressing themselves more than if you're on the side. Actually, the care receiver feels a little bit more secure, and they actually can perform more of the work. So there's less stress on the caregiver, and the care receiver actually it's more healthy for them because they can stay stronger and be more independent. So, one thing we teach is that we want the care receiver to do as much as he or she possibly can. So because it keeps them more independent and strong, and it preserves the caregiver.
Right. Yeah, that's a really important point, I think.
The next thing we talk about is when we're helping people is to be aware of your body type and the body type of the person that you're helping. I'm 6'2", I'm kind of a big guy. I have really long arms. I can kind of scratch my feet with my arm standing up straight. So for me, I position myself in a position to where I can keep the load close to me, as the slide shows, and but it's easier for me to reach around. That way, I can have a nice stable base, and I feel in control, and it's easier for me to help a person move from side to side. If you're of smaller stature than I am, then this position may not work for you. But the key to helping somebody is to always make sure that you're keeping your back straight, that your back is not rounded. Anytime that your back is rounded, you're putting yourself at risk for injury. So this position for me allows me to keep my back straight and control the person.
So in the case of a smaller person, what would you suggest as far as this type of maneuver?
Well, the smaller person would have two options. One option would be to change their position. They may not have arms long enough to reach over, so they'll probably want to get in front, and I think the next slide illustrates that position. So if you can notice in this position, the caregiver here has a wide base of support, as I did. They have their back in a nice neutral position, and they have the load close to them. But they're doing it from going in front because they're using their body type, and so that's really important. And when I work with caregivers, you got to consider your body type and also the body type of the person that you're caring for. Yeah. A third option is kind of a hybrid of the two. That, a lot of people like the reaching over thing, but they don't have long enough arms. And one trick that that works is using a towel. We'll have some caregivers who will say, "Well, I can't bend down to get in front because my knees hurt, or I have a knee injury." And as you talked about, a lot of the caregivers these days are older, and they may have problems with arthritis and things in their knees. And so this trick will allow the person to reach over so they don't have to bend, so it's not as hard on their knees, yet they still can keep the load close to them and keep their back straight and actually have good control of the person that they're trying to help transfer. So,
I suppose that there's some special towels that allow you to hang on to the
actually,
towels.
there are some commercial products out there that have handles
on it?
for people, but I use the good old bath towel. Works just as well.
Okay. That's very good. Now, when we start talking about
Go ahead.
transfer techniques, there are times when, let's say, a person needs to be transferred, as a disabled individual. Are there special things that we need to keep in mind?
Yeah, what I try to do is again, you want to preserve the caregiver, and then you also want to enable the care receiver to do as much as they can. And I kind of present it like you're trying to stack the deck in your favor. So, if the event that you want to do is to transfer somebody from a bed to a wheelchair, then you want to set it up to where it's the easiest for you to do. So the first thing to do is, if they're in a wheelchair, is to set the wheelchair up in a position that is advantageous for you. So if you have an armrest that's removable, you want to remove the armrest so you don't have to lift over it.
Right.
Again, to create less work for you.
Right.
Then you got to consider before you start what position you're going to put the person in. A common mistake you'll see is that if you're going to transfer from a bed to a chair, a lot of people will put the care receiver on the side. Their head will be on and shoulders will be on the side of the surface they're transferring to. And what that does is, if I want to transfer over here, and my head and shoulders are over here, when I'm sitting, I'm weighted on the hip, and it's hard to move. If we move their shoulders and heads away, the hip lifts up, and the hip is going in the direction where you want to go. And so I always remind people when I'm teaching positioning, to make it easier, is are you going to sit on your head, or are you going to sit on your akole? And they'll go, well, I'm going to sit on my akole. So so I teach them the position to where their head and shoulders are moving away, so their akole is actually moving towards the direction of the chair where they want to go.
Okay. Well, you got several more types of transfer techniques that we can talk about here. But for those of you who have just viewed the show very recently, this is the Kupuna Connections TV series on Olelo, and we're talking about injury prevention for caregivers with physical therapist Kevin Lockett. So, share us a little bit more about these techniques of transfer.
Yeah, so where we left off was that you want to basically set it up where it's easier for you, and so that includes the having the chair, anything that you can remove that's in your way. You want to do that. You want to position the person you're transferring in a position that'll be easier for you. So we talked about having the head and shoulders away from the surface you're going to transfer to. And then simple things like if they're in the chair, is to scoop them forward so that you can put their feet on the floor. If the person can bear weight, again, you want them to help you. And again, the more that the care receiver can do, the easier it is for the transfer, and the more that it preserves the caregiver. So a couple of tricks to scoop people forward is if some people can just scoot forward if you ask them, they can do it, and some people may be a little bit harder, especially if they're in a chair that has a cushion and it's hard for them to move. And so one trick is to lean them to one side, pull their hip forward, lean them to one other side, pull their hip forward, and you kind of duck walk them up. And that technique works well because when you lean them, you offload the side that you're going to pull. You offload and pull, and you can more easily get them
To the edge.
To the edge, so you're not just pulling them. And if you pull them, it's dead weight, and then if they have skin issues, you want to decrease the friction. So so it's just little techniques that you can do that make less strain on the caregiver and less stress on the care receiver as well, I suppose.
Okay. Anything else by way of transfer techniques that we missed?
I'd like to talk about the sit to stand transfer. Maybe we could take a look at some of the slides.
I think we're out, Jenny.
Oh, we're out.
Yeah.
Okay.
Okay.
Well, on sitting to standing, this is getting in and out of a chair. It sounds like really simple, but it's an event that some people need help with over and over and over. And so one common mistake that you'll see is if people are trying to get up and they need help, they'll attempt to rise, they'll fall back into their chair, they attempt to rise, and it might take them 3 or 4 attempts to come forward to get up. And then a lot of times you'll see a caregiver, it might be a spouse, so she ends up in front trying to pull them forward, and then she's in this position where they're trying to get up and they're falling back, and she's trying to pull them forward, and there's a lot of stress on her back. So what I teach, the first thing I teach them to do is that you got to position the care receiver forward in the chair. And a technique that I teach is that you want them to sit up tall and have the care receiver bend forward to where their nose are past their toes. So I'm going to just kind of demonstrate this a little bit since the slides are not there. So when they bend forward, your center of gravity is over your feet. So when you use your leg muscles, you go straight up. The common mistake is that when people try to get up, their center of gravity, they only go so far, and when they try to use their legs, it pushes them back in there. And if the care receiver's in the front, the stress goes right to the care goes right to the caregiver. So nose past your toes is another very helpful tip.
Right. Well, and I noticed when you do that, your okole starts coming up automatically.
Right.
So you're getting that extra little boost to.
Right. So a lot of it's using basic leverage to the advantage of the person who's moving. Other tricks is scooting in bed is another problem we hear a lot about.
Right. Yeah, I kind of wanted to ask about that because that's one that I've tried doing. Trying to help my mom move around the bed, and she's heavy, and I'm short. And as soon as I start doing that, I can really feel it in my back. So, what can I do?
Yeah. Well, and that's a common mistake. A lot of people will do is they'll again, they're bending forward into the bed, so they're already in a bad position, so they're stressing their back. So a couple things you can do. One is you can take a bed sheet and scrunch it up, kind of push it under the person, roll them a little bit, and then go on the other side and push them and pull it out. So you basically create a draw sheet, so you can maybe pull the person up or down in bed if you need to, if they can't position themselves. Another trick, actually a caregiver taught me this, is that if you want to reposition somebody in bed, you get them in, a lot of times people sleep in the curled up kind of fetal position. So you get them to where they're laying on their back and you bring their knees up. And then the beds have a little bit of a spring. And so a little trick is to get on the hips and just push down a little bit. And what happens is the bed compresses and then comes back up. When it comes back up, the okole's a little bit lighter, or it's not as weighted, and it's easier to scoot their hips and position them that way. So it's kind of a series of pushing down and moving, pushing down and moving to get them in.
Now, where's the caregiver in this? Above the
caregiver's right
right
above, and that's the point that I'm glad you mentioned that. It is there is not a wrong position as a caregiver. You know, you have to be in a position that you keep your back in a neutral position. The minute that, the second that you round your back, you're going to put yourself at risk for injury. So in that instance, you know, it may mean that you may have one leg up in the bed. You know, whatever position you need to get in to move them that keeps that back from being, you know, rounded is the right position. So, you know, for somebody of smaller stature, they may have to put their one leg up in the bed to try to do that.
I see. I see.
Well, it sounds like, you know, several things that you've described you do in kind of small increments as opposed to doing the whole movement at once. Like moving from the back of the chair forward, you're kind of scooting, and then if you're moving them up in the bed, you know, like pressing down, getting them, that you might do that several times, you said, so you're not doing all at once.
Right. Yeah, and you know, and again, you're trying to achieve, you know, a certain goal, whether it's repositioning or getting them in and out of bed or getting them from lying down to sitting up. And if you skip steps, you know, you can, again, common, you know, you can see in some care facilities, the nursing aides are trying to get multiple people up, and they're moving around really fast, and they're, you know, they're just bending forward and pulling people up, and then at the end of the day, they're rubbing their back on, oh, my back is sore, and so it's really taking doing those little things. Don't take that much more time, but it really makes a big difference in regards to decreasing the cumulative stress, you know, throughout the day as being a caregiver.
Oh, okay.
Right.
Well, again, for those of you who just come on and watched our show, this is the Kupuna Connections TV series. We have Kevin Lockett with Ohana Pacific Rehab that is talking to us about injury prevention for caregivers. So, Kevin, another question that I had to do with those that are sitting in their chairs and begin to slide. You know, let's say they're in a wheelchair or a regular chair and begin to slide out of position. What do you do about situations like that? Obviously, they can be slouching, and that's probably not good for them as well. What do you do?
Yeah, you know, that's a common problem is people will usually position people in a wheelchair, and they'll get them nice position, they'll look good, and then, you know, they'll turn around, and 5 minutes later, they're almost on the floor, and the seatbelt's up around, you know, their chest, that type of thing. So, to reposition them, that's a common mistake that you'll see too. Is people will tend to go behind the person and grab the shoulders to try to pull them back up, and you got to be careful with that because the shoulder joint is the most mobile joint, but it's probably the least stable joint that we have in our body, and so I try not when I teach people to move, I instruct them not to grab underneath here because especially if it's a more frail elderly person. You know, you could injure their shoulders. The other thing is that your blood vessels and your nerves go under here, and it's you know, you can injure them, and it hurts to pull in there. So what I recommend is that you actually go behind the chair and go behind the person, and put your arms around them, and then you lightly grab their wrists, and they have the person squeeze you, and so the pressure is actually on their flank or their side, which can take pressure, and then you can scoop them back up. You know, so that's a good way to do it.
So you're lifting them from the elbow, essentially. Is that right?
You're actually going behind the person, and then you're putting your hand here, and the person's squeezing you. So the pressure is on the side. And the other thing to keep in mind is that a lot of the elderly will have very fragile skin.
Yes.
And so, you know, kind of the really onion peel skin, and will be on blood thinners and things. So you don't want to grab them.
Yeah.
You got to grab them.
How about exercises? Are there some simple exercises that caregivers can do to strengthen the muscles that they need to help move somebody?
Yeah, the things that we recommend is actually two things. One, excuse me. One is to work on your core muscles. You know, you have to think of your trunk as kind of like the foundation to a house. So the stronger that the foundation is, the stronger the superstructure, the walls are your limbs. And so the stronger your muscles are in your stomach and your back, it protects your spine. It basically acts like a brace. And so Pilates, yoga, just doing stomach exercises, different types of crunches, those types of things are good to do. The other exercises are posture exercises. So I spend a lot of time teaching people to, just watch the posture, squeeze your shoulders back, those types of things, because it puts us in a position where there's less stress on the joints if there's balance around the joints versus being in this type of position. So a lot of posture exercises for the scapula and those sort of things like that.
I see. Now, well, we've just got a few minutes left, but perhaps you could kind of tell our viewers whom they can call and what number they could call in case they had any questions.
Yeah, we actually have a website that has a lot of information and some videos and instruction on how to do transfers and different things. And our website you can find.
The website is?
It's ohanapacificrehab.com.
ohanapacificrehab.com.
Right,
Okay,
right.
okay.
And if you had any questions, you can reach me, on that site as well, and I'd be happy
Great, great.
to do it.
We should also mention that Kevin has just recently published a book for caregivers. And Kevin, can you show us a copy of that front cover?
Yeah, it just came out.
Probably hard to see perhaps for viewers, but Caregivers Complete Guide for Safe Mobility and Independence in the Home. It's in the bookstores and probably of great use to all of our viewers out there that are caring for their loved ones. So thank you, Kevin. Before we end, though, perhaps you can give our viewers one last advice. We've had so much information, good stuff for them to take to heart. But if they had to just remember one thing, what would that be?
Well, one thing would be is to keep a neutral spine, keep your back straight regardless of what you're doing. If you're in the kitchen helping them in the bed, if you're gardening, if you keep a neutral spine and not a rounded back, you'll stay out of trouble.
Okay, sounds very good. So thank you very much, everyone, for watching our show today, and hope to see you again next week. This is the Kupuna Connections TV series. Aloha.